So today we're going to discuss the admission of a patient that's coming in from the OR and the whole admission process with receiving a patient from the OR. So once you get the call that they're transporting, you need to have the unit secretary call respiratory and make sure that she's been made aware that the case is coming up. So once the case is rolled in the room, so Mr. George is rolled in the room, he typically just has a sheet on him. You'll have your monitor at the end of your bed, and then when you pull the covers back, you're going to have your transducer and your flush system. So you have a primary nurse and you have a secondary nurse, and each has their own roles of what they're supposed to do. We'll discuss that in just a second. So once you pull the covers back and you've freed your lines, you can take the Philips handheld monitor. Once your lines are free, and go from here straight to the monitor so that it is one seamless process, so that there is no delay in the patient, in the monitoring of the patient, okay? Your cords and lines are all kind of jumbled up, and that's just the nature of the beast in trying to get things situated, okay? So once you have that, your patient will come up on your monitor. The primary person will write down the vital signs, and then the secondary person will do the task. So with that being said, first of all, you're just going to take a note of what your vitals are. Your QRS tone on the monitor should always be on, because there's lots of people in the room when the admission takes place. So you need to be listening for the QRS tone in the sense of when there is a change. So typically, once it comes up and you have your vital signs on the screen, you then can take your cardiac output with your hemisphere and hook it up to your Swan. Your transducer goes on your pole. Your cardiac output gets hooked to your Swan, and the most important, just always remember, white is to white, and blue is to blue, and this is that creates your thermodilution for your cardiac output and index for your numbers. So while everything else is kind of getting settled, you're getting the patient hooked up, you're listening to your monitor, you're looking at your monitor, you've got your hemisphere kind of hooked up, your secondary person can start getting your lines situated. They will draw your labs. They'll draw your BMP, your CBC, your MAG, and your coags, and your fibrinogen. Also at that time when you pull lab, you will pull your Chem 8 as well for Dr. Hoffman to see. So let's go back to kind of the role of the primary nurse. The biggest thing that we want to make sure you guys are doing is making sure that you're leveling and zeroing your patient appropriately. You should be using the leveler to level with the mid-specific axis. Oh my gosh, I can't even talk. With your transducer, okay? So I always make it a note to mark on my patient, so that I'm making sure that the person following me is also doing the same, okay? So your transducer, your three lines should be level and zeroed with your patient once you get started. And that is just to ensure that your numbers are all correct. Once you have all that, you can zero now. So you turn your stopcocks away from the patient. So always remember, up is off to your patient. So you remove these caps. I will say, let me just remind everyone too, so when the patient comes up, sometimes anesthesia gets busy and they forget to replace these little clear caps. So always remember that you replace them with these yellow dead ender caps, because these have a hole in them, and the patient could actually even get air through that if it was not cut off to them. So just make sure, as a safety thing, that's part of your safety check when you're hooking everything up. So back to zero. So once you get everything is off to your patient, and you'll see your stopcocks are all up. Okay, this is your arterial, your PA, and your CVP. So typically these all come hooked up to your dongle that we talked about, your cords, okay? And all you have to do, like I said, is just plug it in. So you will hit zero